It's especially significant, I'd point out, that we meet here as President Obama prepares to address the nation this evening to announce his plans for withdrawing thousands of troops from Afghanistan. Our returning service members have always faced barriers to finding employment, whether due to mental and physical injuries sustained in service or the fact that our employer base often fails to properly value military service. However, circumstances facing our returning troops right now are extraordinary. Our nation is still recovering from a brutal economic recession, and more than 1 in 5 young male veterans returning from Iraq and Afghanistan are unemployed. These numbers are unacceptable, and there's a signal for an urgent need for government and the private sector to band together, as we are doing here today, to help our heroes find jobs that can support their families and ensure bright futures. And finally, just a quick word before I finish about the greatest opportunity, the greatest privilege I have as a member of Congress, which is visiting with our troops and visiting with returning heroes, as I did recently on a visit to Walter Reed. Every individual that you have occasion to meet at Walter Reed is an honor and a privilege. But there's one in particular I'd just like to conclude my comments with a reference. His name is Adam Keyes, Army specialist, who also lost both of his legs and an arm in an IED attack in Afghanistan. Lying in his hospital bed, he has every excuse in the world to be down and to be frustrated, but he wasn't. And what was so incredibly inspiring was to hear him talk about how he looks forward in the coming weeks to getting his new hand and learning how to use his hand. And then they told him within 3 months they would fit him with his new legs. He would look forward to learning how to walk again, and then completing his rehabilitation and leaving the hospital to go out to live his life. His optimism was absolutely inspiring. And ladies and gentlemen, there need to be jobs for soldiers like Adam, soldiers who risk their lives so that we may enjoy the freedom and opportunity afforded to every one of us in this room. They fought for us. It's time that we fight for them and their families and for their futures. That's why we're here today. That's why this is so vitally important. I'm just proud to be part of this event, an event that will ensure that brave young men and women like Adam will have good jobs, will be able to live their dreams. And I thank you for the role that all of you are going to play to help make sure that that happens. Thank you.
Thank you, Congressman, and also thank you for helping us put this together. I know that you and your staff were very involved behind the scenes and orchestrating some of these events and really actively participating. I don't think we could have done it without your help, so very much appreciate that and your comments and sneaking over here. I know this is a busy day for you all. Madam Secretary needs to leave for another meeting. We very much appreciate your coming and your support, and we look forward to working with you and your team as we go forward.
Thank you. Good luck. Thank you.
I'd like to recognize John Campbell, the Deputy Assistant Secretary for the U.S. Department of Defense. Mr. Campbell.
Dr. Lira, I want to thank you so much for the kind invitation, and I want to thank everyone for coming today, the government officials, the ones that we're working with quite closely at DOL, Department of Labor, at HUD, in the Veterans Administration. We have an exciting challenge ahead of us. The unemployment rate for younger Iraq and Afghanistan veterans is up at about 30%. We are working very closely with those agencies to create better programs so that we're able to provide these young men and women who are truly spectacular. I think some of the stories the Congressman was mentioning, and I know Dave McIntyre and I were out at the Warrior Games a couple of weeks ago, and you just can't believe the spirit, the enthusiasm of these young men and women who have obstacles, physical obstacles, that they are overcoming with just amazing strength and fortitude. I witnessed a single amputee, special forces soldier who was on a hand cycle, and he was in a race. Wasn't winning it, but he was competing, and we were about 2 kilometers from the end, and it was an uphill slope to the finish line. And this young man had his chain break. Now, for most of us, that would be the end of the race, but for this young man, he used his hands on the asphalt, uphill, to pull himself to the finish line. He wanted to finish. It was really, really important, obviously, to him. And what an inspiration it was for all of us. And so I would like to leave you with the thought that we're really talking about an extraordinary group of young men and women. And I come out of the private sector, coming into this job and dealing with global economic issues. And I have to say that if we don't employ these young men and women who have incredible skills, not just, I mean, sure, they've got the leadership and the war-fighting skills, and that's a whole area unto itself, but they also have the political activist skills, community or integration, working overseas, dealing with the local imam, logistical projects that are mind-blowing in a wartime situation. We don't employ them, we are not going to be able to compete globally. To me, this is a national security issue. It really is one where we really need to bring every element, every asset we can bear to make sure that we can compete globally among some very formidable opponents or competitors around the world. So I thank you for the invitation. I think it's just wonderful. The healthcare industry clearly is one that has jobs, will continue to have jobs going forward, and I encourage you to use whatever anything you can do to employ these young men and women, and my office will be as helpful as it can to help you do that. So thank you again, Dr. Lehrer, for inviting me.
Thank you. I appreciate the comments. For the next portion of the program, what we'd like to do is, as I mentioned in the opening, we were going to address a number of topics that were specific to some issues in terms of both identifying, finding, hiring wounded veterans, and then this is not just about hiring, but it's about sustainability. It's not only finding jobs and hiring folks into those jobs, but it's allowing them to be successful in those jobs and to retain those jobs. So in the first topic that we identified, we talked about successfully recruiting and retaining veterans as employees. And I would like to ask some of the panelists to give a few minutes and then open it up to discussion for everyone. Let me first turn it over to David McIntyre. David is the President and CEO of the TriWest Healthcare Alliance, which services the TRICARE group in the western 21 states.
Dr. Lehrer, thank you for your leadership and your company's leadership in issuing the call for all of us to come together, and Secretary Campbell, Congressman Deutch, and the Secretary of Labor. Thanks to all that you're doing and your departments are doing and Congress is doing to help us all lean forward and do the right thing. We've seen a lot of progress being made in that regard. I'm privileged to be the one who has the opportunity to address briefly the topic of hiring and retaining veterans, and I'd like to recognize and acknowledge my colleagues from HealthNet, Tom Corrado and Dave Baker from Humana. The three of our organizations have the very unique privilege and awesome responsibility to care for the healthcare needs of the military population. And we do that at the side of the Department of Defense, and it's an incredible privilege that the three of our organizations have to do that. And I want to speak just a little bit about my window, our organization's window into this topic. We take care of 3 million of that population in the western 21 states. That's our job. That's what we do. That's what we have the opportunity to do. And the Secretary captured well, those who have served are incredible employees. And as Secretary Campbell talked about, they are leaders, they're skilled. Many of them have healthcare experience, even though they may not have the formal certified training that we might think about in the private marketplace, because they had to get trained in order to rescue their colleagues or to save themselves in a firefight. And they are people who have the soft power skills of diplomacy. They are really diplomats in uniform for all intents and purposes, especially in Afghanistan at the moment. And they are teachable, and we've certainly discovered that in our own organization. As a company, when we started doing this work 16 years ago, we made a commitment as we built the organization to have a 50-50 relationship in our employment base. And what that means is we wanted 50% coming from the population that we served, those who had served, those who are serving in the Guard, their family members, and then 50% coming from the private sector. And we kept that balance pretty strong. We've hired a few wounded warriors along the way. I'm telling you here today that I don't think we're doing enough in the wounded warrior space. And we're going to make a commitment to redouble that effort and that focus. And I want to talk just for a second about some of the things that we've learned around the challenge of identifying those that are wounded warriors and then being able to retain them when we get them. We've had Silver Star recipients in our company. We've had amputees in our company. We've had people that have had extreme post-traumatic stress. And they are amazing Americans. They are incredibly skilled. Attracting them is a challenge. And it's a challenge because it's not easy today to find them. We don't have a single place to go as employers. There isn't an easy connector. There needs to be an easy connector where you take the employer on one side and you take the person looking for a job and you put those two pieces together. There are great people in this country working on that. I'm confident that that will come, but that is a challenge. So in the intervening time, there are job fairs being held. There are things being done by the Department of Labor. I'm sure every member of Congress is asking every single employer that walks through their doors, what are you doing to help with the lift? That's the easiest thing that can be done without having a program. And so the opportunity to attract folks, we can lean forward, but it's still a challenge to try and get to that connection in an easy way. When you find them, it's easy to attract them. From a healthcare perspective, there are people that are very interested in being in the organizations that we all represent. But then when you have them, the question is, how do you make it successful for them to find success in the environment that you represent? What we've ended up doing is building support groups within our company so that they can connect together with people who can relate to what they've been through. Everyone champions and supports their experience, but they need to be able to have conversations with those that can actually relate to where they've come from. Secondly, you have to have flexibility as an employer. We're an organization, not unlike our two colleagues, who have very, very strict performance requirements that we have to meet. And I'm confident that my colleagues, just like I, are very focused on how we make sure we deliver against that. Sometimes people need flexibility. Sometimes this group, as they get immersed in what they're doing, need that flexibility. So it's important as an employer to think that through on the front end so that you create support within the performance for all of them. And then the whole issue of behavioral health support. And I want to compliment Mellon for leaning all the way forward on the EAP issue. That is a fabulous idea. You can count on the fact that I'm going to use that interconnector. Because what I've come to realize is that many of those coming back are being encouraged to lean forward and get help. And they're doing it.